Senator for Tennessee.
Thank you, Mr. President. I wanted to just join with my colleagues this week to mark the implementation of an updated and streamlined health care system that is specifically for our veterans. And this is made possible by the VA Mission Act. Now, in Tennessee, we have such a large and vigorous and wonderful population of veterans, and I will tell you, we are so grateful to them for their service, and so grateful that they have chosen to make Tennessee their retirement home. And I had one of our colleagues ask me one day about how patriotic Tennessee is. They had been there to visit. They saw flags out in so many places. They saw signs out that were thank you signs to our veterans. And I told them that I felt like it was because we do have a strong military presence. Fort Campbell is primarily in Tennessee. We have Millington, the Air Naval Station. We have Arnold. We have our National Guard, which is just a couple of our units have just finished a good deployment. But we cherish these veterans, and they are such an integral part of our communities and our churches. And so we've worked diligently on this healthcare system for veterans to meet their needs, specifically meet their needs. And you know, Mr. President, that should be the mission of the VA. It's not to serve itself, but to serve the veterans. So once this new structure that is put in place by the Mission Act is fully implemented, members of the military community who have been, in my words, neglected for too long, their access to health care neglected, they're finally going to get the attention and the care that they need. And I use that term neglected because anybody who knows that they were headed to the VA clinic for a checkup knew that that was not going to be a quick checkup, that there's a lot of paperwork that goes into that process of asking for that checkup and then seeing it actually take place. I've heard from hundreds of veterans with their stories and their experiences, and sometimes you will hear them say, it was a comedy of errors, but it is no comedy. It is a catastrophe of errors. And the consequences from this have really taken a toll on the life and the health and the safety and sometimes the sanity of our veterans community. And the reason you hear these stories is because we've asked generations of veterans to put their physical and their emotional health in the hands of practitioners whose hands were tied by arbitrary rules and procedures that turned even simple procedures into what would be a logistical nightmare. And Mr. President, I have no doubt if we went around this chamber and each member of this chamber were to stand, they could, without any notes, right off the top of their head, they could give us a story that they have heard from a veteran. That should never happen. But as of this month, we've dealt with a lot of these issues. We have removed some of the roadblocks, and the new community care program, which adopted elements from the successful Veterans Choice Program, will continue to allow veterans to seek care closer to home. What was once a cluster of 7 programs has been merged into one single system, a whole of health, whole of the soldier approach. And it makes this process simpler and easier to understand, and to implement this program. Options will expand even more with the authorization of local provider agreements and access to walk-in community clinics. Specifically and precisely what veterans have said for years they want. Just let me go to the doctor in my hometown. We've got a neighborhood clinic over here. We have a clinic over at the pharmacy, the CVS or the Walgreens. Let me go there and not have to drive to a clinic that is out of town. One provision in particular that I believe is going to really make a big difference is the removal of barriers that have prevented VA healthcare professionals from practicing telemedicine. Any of us who have used telemedicine and have Skyped with a physician know that this is a time saver. It gets you in front of the doctor in a more expeditious fashion. It allows you to get that advice to start taking and treating your ailment sooner. It is a huge time saver. This is now going to be available. As we are crafting these updates, we're careful to consider the cost to the patient and to make sure that veterans won't have to worry about receiving a massive bill if they see a provider at a local community facility. The VA Mission Act keeps cost at these clinics in line with those at the VA healthcare centers. We've also taken steps to encourage consistent treatment at the VA healthcare centers by providing the funds necessary for these clinics to retain top talent. You have to have healthcare professionals in the clinics in order for these clinics to see their patients. Most importantly, the VA Mission Act supports these changes via an updated and extensive system of reporting and accountability. For years, this body has debated the merits of various health care regimes for children, the elderly, and the poor. But for some reason, we've asked veterans to accept a system incapable of providing care without snarling patients in miles and miles of red tape. For this, we owe the veterans community an apology, and it is an honor to work with our veterans and now say the VA Mission Act is being implemented and care is coming to your community. I think this reflects a sincere desire to do right by our best and our bravest. I yield the floor.